Hi, would you like to have a stroke with a side of disability? Who in their right mind would ask for something so terrible, so devastating? Yet 11 million Americans are unwittingly asking exactly for that every single day. Why does it happen? Because those 11 million Americans have undiagnosed hypertension. I recently saw a patient who went to the emergency room with a TIA. TIA stands for transient ischemic attack, and it's a prelude to the stroke. The good news is, once the symptoms happen, if it is a TIA, it resolves and there is no lasting brain damage. But guess what? Next time these symptoms happen, a person may actually have a stroke. This patient was in the emergency room and was found to have blood pressure that was sky high. She had what we call a hypertensive urgency. Despite that, after initial blood pressure lowering, she was sent home on no medication and no lifestyle plan. And turns out that among 75 million Americans who suffer from high blood pressure, half do not have it under control. Nearly 50% of all adults in the US have hypertension, 47.7% exactly. So what is it that you should know? Number one, know, be fast. If you find yourself in a situation where you're losing balance, losing vision, or experiencing blurriness in one of your eyes, developing facial numbness or weakness on one of the sides, suffering from arm weakness or arm numbness on one of the sides, and find that your speech is slurred or affected, you need to be really fast, and T stands for time. Call 911, go to the emergency room, do not delay. We can save your brain. Number two, you do not need a doctor or healthcare practitioner to determine if you're at risk of a stroke. Get a blood pressure cuff, use that blood pressure cuff, check your blood pressure AM and PM when you're calm, not agitated, on an empty bladder, without any caffeine, not after a workout, not after a stressful interaction, just at rest, and keep that log, that diary of your blood pressure. If you're going to find that your average blood pressure is 130/80 or higher, guess what? You are hypertensive. And actually, by the recent guidelines, anything over 80 is considered hypertension. So remember, number one, be fast. Number two, know your blood pressure number, because you don't want to gamble with your brain health or your life. I'm Dr. Regina Druz, and I'm an integrative cardiologist. Check out my YouTube channel and podcast.